Hi and welcome to UHS. My name's Heather Vance and I'm a family medicine doctor here at UHS.
My name is Layla Berry. I'm one of the nurse practitioners here at UHS.
We're going to show you a video on how to successfully train your staff to perform deep nasal or mid-turbinate swabs. Let's get started. First, you want to identify the equipment that you'll need, like your PPE. You can see here we have hand sanitizer, we have a gown, a face shield, a face mask, and gloves. You're going to want to use an N95 if you're swabbing a symptomatic patient, but if you're swabbing an asymptomatic patient, an ear loop surgical mask is just fine. Then you'll want to gather your supplies for actually collecting your swab, which we have here. So you'll have a viral media tube, a patient identifier label, a swab, and a specimen bag.
Now I'm going to play the role of the patient and Heather is going to play the role of the provider. Heather is now going to show you how to properly put on your PPE. Of course, normally PPE would be applied outside of the patient's room, but for video purposes, we're going to show you now.
So first you're going to want to hand sanitize or wash your hands. Remember, this should be done for approximately 30 seconds. But I'm going to show you the abbreviated version here. So next, I'm going to put on my gown. You want to put your thumbs through the holes and your head through the larger hole. Loosely secure this in the back. So next I'm going to put on my mask. Again, I'm going to use an N95 here considering that my patient is symptomatic. Next is my face shield. And last I'll put on my gloves. Okay, now I have all my PPE on and we're ready to test. So first, it's always a good idea to make sure that your patient has the appropriate mask on. If Layla had symptoms, we would want her to have a surgical ear loop mask on, which she has on. Then the next step would be confirming her name and date of birth on your label. Can you confirm that your name and date of birth are correct here?
Yes, it's correct.
Perfect. I'm going to hand her the tube and ask her to put her label on her tube herself. Next, I'm going to explain to her what the procedure is like so she knows what to expect. So this is called a deep nasal or mid-turbinate swab, which you're going to perform on yourself. When we're ready, I'm going to have you remove your mask so that only your nose is exposed. Then you're going to tilt your head back about 20 to 30 degrees. You're going to open your swab, being careful not to touch the tip of your swab. You're going to gently insert this into one nostril until you hit resistance. In general, that's about 3 to 4 centimeters or 1.5 inches. Once you're there, you're going to rotate this several times for about 15 seconds or 4 to 5 rotations before removing it and repeating the same process on the other side. When you're done, I'm going to give you instructions on how to put it back into your bottle, which you'll be holding, cap it, and put it into the bag.
Okay.
Do you have any questions?
No.
Okay, let's get started. So I'm going to have you hold on to your own tube, and I'm going to open this for you. It's always a good idea to show your patient about how far in you're talking. So when we're looking at the tube, the swab, nothing is marked at 3 to 4 centimeters. So I would tell her, this is about how far you want to go in or until you meet resistance. I'm going to open it so that she touches the swab and I don't. Now when you're ready, you can see she's lowered her mask so only her nose is exposed. And you can go ahead and tilt your head back about 15 to 30 degrees. Gently insert your swab in one nostril so that it's parallel to the roof of your mouth. And keep going until you hit resistance, which should be about 3 to 4 centimeters or 1.5 inches. So it looks like you might not be in far enough. Nice job. If you find that they're not far enough, they might be only swabbing their anterior nasal portion of the nostril, at which point you want to try and help correct them. That's great. Go ahead and do the other side. Again, she's swabbing 4 to 5 times, making sure that she makes contact with the nasal wall. Nice job. So now you're going to uncap your tube. You're going to put your swab in, making sure the tip contacts the liquid in the bottom. You're going to break at the perforation mark. You can discard that piece, put your cap on your tube, make sure it's secured tightly, and go ahead and drop it in the bag. So I'm going to confirm that this is tightly secured, that it's labeled with the right person and ID. I'm going to ask Layla to make sure she puts her mask back over her nose, and I'm going to have her hand sanitize before we turn her specimen in, which she has right over here. Is there any questions that you have?
No.
All right, you should be getting your results in the portal shortly.
Perfect. Thank you.
Thank you for watching.
1, 2, 3.
Heather will now demonstrate how to properly remove your PPE.
So first I'm going to take off my gown and my gloves at the same time. Sanitize my hands. "30 seconds have gone by. Next, I'm going to take off my face shield. Again, hand sanitize. And last, I'm going to take off my mask. Now remember, these procedures might change slightly if you're doing these tests one after the other in a tent location, a drive-through location. In those cases, it's always important that you switch your gloves and use hand sanitizer between every patient. However, if you are in a space where the patient happens to cough on you or sneeze on you, it is important that you remove all of your PPE and replace it before moving on to the next patient. That wraps it up. Thanks for watching our video.
Thanks, and we hope this was helpful.